for money, and now research has shown that some companies are making profits of almost 40%. Let's speak with Stephen Dorrell, former Health Secretary and Chair of the NHS Confederation. Evening to you, Mr. Dorrell.
Good evening.
These are telephone number-like figures, of course. I mentioned that word controversy. There's always been controversy around PFI. These schemes don't ever seem to get much of a good press. I know this didn't happen under your watch, but can you see redeeming qualities in PFI?
Well, I think that there's a great danger when we talk about the partnerships between public and private sector in the NHS that we see that there are definitely things that were wrong with the PFI deals that were done, and therefore conclude that there's no future in partnership between public and private sector. And that, I think, would be a great mistake. It's definitely true that some of the PFI projects, and in particular when they produce profits of 40% for individual companies, more than likely, without knowing the detail of the specific deal, more than likely that was a bad value deal.
Sure.
But what I think happened, because they were so keen in the early years of the PFI to get deals away, what happened was that the state guaranteed returns to the private sector, which those guarantees should never have been given. But I don't draw the conclusion from that fact, which is true, that there's no future for public-private partnerships. I think the other thing we need to remember is that when people say private companies made profits out of building buildings and providing facilities to the health service, if the private company hadn't done that and hadn't made a profit, the alternative is that the Treasury would have provided the capital, and people shouldn't assume that capital to build a hospital provided by the Treasury is free. It isn't free. It has to be borrowed through Treasury bills, and interest has to be paid on it. So it's looking at the difference.
So in effect,
different ways of doing it.
So in effect, the principle of PFI, it's not the principle of PFI, it's just that some of those contracts would have just simply been badly negotiated.
Correct.
And in terms of what we gain extra then, I mean, you gave the analogy there of what would happen if the Treasury had to fund all of these schemes and do so, as you rightly say, via borrowing, and that incurs interest rates, etc. Over and above the fact that perhaps the private sector might be able to come in slightly cheaper, oddly, what else do we benefit as taxpayers, as citizens of the UK? What could you point to say that PFI can do that the state simply doesn't do either as well or at all?
Well, I actually don't approach this subject by saying either that it's better done in the private sector or that it's better done in the public sector. If what you're seeking to do is to provide the best value health service through the NHS to patients in the UK, then surely what you should do is look at the best deal available, whether it comes from the public sector or the private sector. Sometimes it will be one, sometimes it will be the other. But why would you want to exclude either the public sector or the private sector from providing the best value solution to a particular problem at a particular time?
Because, of course, we know that there is that, certainly, and this tends to happen, as you'll be more than aware than me, Stephen Dorrell, when the Conservatives are in power. The NHS, of course, is ripe for privatisation, and that narrative follows your party around like a bad smell.
Well, it follows us around like a shadow. But as I used to say when I was Health Secretary now some time ago, if the Tory party really wanted to privatise the health service, there'd been quite a lot of Tory governments since 1948. Presumably one of them would have got around to doing it. They haven't, because the Tory party has never been committed to the privatisation of the health service. What the Tory party and the Blair government, what there is actually, I think, a broad cross-party agreement is a good idea, is that when you're providing services for patients, the key priority should be to deliver the best value and the highest quality for the taxpayer pounds that you're spending on providing that service.
I think I'm right to say you were the last Health Secretary before the Blair government, weren't you, under John Major's Conservatives? Of course, you know, in that those intervening years, quite a lot has happened, and we mentioned there the allegations or the suggestion that the Conservatives want to privatise the NHS. That narrative has never been more firmly on the agenda than under this current government, or the accusation of that narrative has never been more firmly on the agenda. Would you still refute that? Mr. Hunt and Theresa May, between them, you don't think they have any intentions of taking the private elements of the NHS further than it currently is?
No, I don't. What I don't think is true of Jeremy Hunt or Theresa May, any more than it's been true of any of their Tory or Labour predecessors, is that they're committed to trying dogmatically to increase the share of private sector provision in the health service. It's always worth remembering the health service was established by Nair and Bevan in 1948 as a public-private partnership. It has never been wholly state-provided. It's always been provided, in the majority, and certainly all the big hospitals, by the public sector. But there's always been private sector providers of the services that we experience in the NHS. The best example of that is community pharmacy. Your local chemist has always been an NHS service provided by the private sector.